would like to thank Counsel Academy for giving me this wonderful opportunity on your platform to spread awareness about acupressure and other related alternative medicines to cure the ailments. And thank you so much. And I am Jayanti Kabra from Mumbai, India, and I am an acupressure therapist since past almost 30 years.
I am Jayanti Kabra. I am from Kolkata. I have done my studying school and college from Kolkata, and now I am here at Mumbai. I have two children. One is a graduate and another is studying in high school. And I love to sing. I am into many creative activities, and I really love to treat people with acupressure, Sujok and Reiki and other techniques.
Acupressure, acu means acute, pointed, sharpened. So we give acute pressures to the precise area and we treat. Acupressure points are located in the palms and the feet and in different parts of the body, and they really help to cure they are helpful in curing almost 70% of the diseases, which can be cured just by acupressure without having medicines, without any side effects, and really great and helpful. This is such a nice question. When I was young, I remember when I was around 12 years old, my mother used to practice acupressure, and it was unbelieving when she used to give pressure, and the people with simple pains, headache, stomachache or any other ailment, they got cured, and it really fascinated me. So that was the first step towards acupressure, and later on I kept on doing the courses, other courses also. Sujok is also a similar therapy, and I learned that, and I've been continuing it since past. I've been upgrading myself regularly with the extra classes and camps, and yes, I've been into this. It was so simple. When I learned in the beginning, I used to practice among friends and family and my near and dear ones. And just by pressing simple points, we have points in our palms and feet, and just by pressing them and seeing that they got relief from the pressure points, they got instant relief, and it really fascinated. And just the journey began with Sujok and acupressure working all hand in hand. It gave miraculous results, and I went on. When I started practicing it along with family and friends, as I said before, I started with a social service. I worked with a for the social welfare, and then I found that it not just that, it also worked on major diseases like spondylitis, paralysis, arthritis, cervical or any stomach related ailments, frozen shoulder, tennis elbow, asthma. They all got cured with just acupressure and simple other remedies. Yes, of course. Acupressure really releases the stress. We have to give the pressure points. How acupressure works is, we activate the glands. We have the glands, and the glands points are located in our feet, which activates the glands such as pituitary, pineal, adrenal, thyroid, etc. The lymphatic glands. These glands releases the juices and they really help in the stress management. Also, we have the points to uh, release the stress in the say head points and head related points and other points. We have points. We have the head points which we give in the head, and that really releases all the stress, and the youth or anybody may it be, any human being gets relaxed. Yes, there's a junction. There's a point located in the palm, and this is between the forefinger and the thumb. The alignment of this finger and the thumb, and here is the point. And this is the back of the palm also. We press it this way in an angular way. This is really effective for all the pains, and it really gives instant relief from many pains and the adrenal stress management. Plus, this point is very effective for cough and cold, for any thyroid related diseases, and many more, all related to them. I am associated with a social service organization called Jai Bhagwan Acupressure Services International, and we regularly give, there are hundreds of people, we regularly organize camps throughout India, across the world too, for treating people free of cost. And then I also have my clinic which I operate, and we have patients coming in there. Many doctors and physicians, they refer acupressure therapists and physiotherapists for further treatments for any nerve related issues, for say suppose paralysis, or maybe if you get a accident and the nerve stops working. So when you give pressure, acupressure and to physiotherapists, either would work equally, and the nerve starts working, and it really helps. So yes, the doctors and the physicians also prescribe therapists for further continued treatments for easy and quick recovery. It gives me immense satisfaction when a person gets cured. Say suppose what we have seen is people coming in crutches, say paralytic patients coming in crutches, and after a single or maybe within 5-6 sittings, I have seen a person who just forgot his crutches and he went away walking. I was really delighted, and it really happens when people just get cured and they are unable to sit down, they are unable to walk, and with a single sitting, within a single or 1 or 2 sittings, they just walk very easily. So this is giving, I'm sure anybody who is practicing it would definitely say that this is a miraculous therapy. They have the simple questions. Will I get cured? How much time will it take? What are your charges? These are the basic questions which almost everybody asks. But as they have faith, once they see within a single sitting, they have the faith. In a single sitting, they start with it, and when they see results, they definitely come again, and most of them get cured too for the longer duration. As I said earlier, they take time and they really have faith, they develop it and they come back again. It I agree to it. It pains when there is correct point. It pains, but we have to console the patient that okay, it will pain for a minute or two, but your long pain, the pain you have in since many years or maybe many months, it will get cured. And within a sitting, they realize it. They have to wait for a when I pay, if it pains. Suppose they have a pain in the neck or shoulder pain. We have a points over here. So we give point, and if if they have pain, it will really pain much over here. We can give points from hand as well as instruments, and it will pain here. So this pain is too much for the time, but then it cures the nerves. That is scientific, and it really cures the pain over there. So as it works like as we switch on the light, we press the switch and the light gets on or the doorbell gets on. So the pressure points works like that. So they get cured. First they don't have faith. How will it work? You're giving pressure here. How will this get cured? But once they see the results, they come back. No, it's not that way. It all depends on what the ailment is and how much time the ailment is there. For simple things, for say suppose a pain which has just arise, the acupressure treats them immediately within 1 or 2 sittings maximum. But if you have a pain with a longer duration, since some people have sciatica pain which is there since past 1 or 2 years, or maybe maybe a paralytic patient since 5 years, so it really takes time. If you come immediately with the problem, with the ailments, it just cures immediately. Say a paralysis, if it just occurred, it gets cured. It gets completely cured within for 3 to 4 months of treatment, because it is a long process. Paralysis takes some time, but it gets completely cured. But for other things, say sciatica or arthritis, you have to take some precautions, and with acupressure it gets cured within 10, 15, 20 sittings, depends on how old and what is the reason behind the diseases, ailments.
Got it.
Acupressure started from China. It is there in India predominantly, and it is spreading throughout the world. And since everybody is seeing the results, they are all accepting it and following it too. I believe acupressure has to be there in every home, and you should have a feeling. You should have the feeling to cure others, and it really works wonders. And you have to have faith in yourself, and the person who is treating, who is being getting treated, they also need to have faith, complete faith, and it really works wonders, to be very sure. Yes, you need to know the mental state of the patient also, and also sometimes it's difficult to handle a patient because they cannot bear the pain, and you need to tell them, you need to assure them that it is okay, it will pain for a minute or two, but you will be fine. And the skills are required to handle a patient. It's not just the pressure we can, and we have to understand the history of the patient. Some patients, based on the experience of the person can charge around start from rupees 300 to rupees 3000 per sitting, and can earn from 30,000 rupees to 3 lakh rupees. It depends on how you do the pressure and how much result you give.